Hello, I'm Hunter Muller, founder and CEO of HMG Strategy. Excited to offer a new build in the HMG model, the new HMG go-to-market model. Our advisory boards are pivoting to represent digital think tanks, if you will. Digital connections to help you ideate around what matters most to you, the tech leader, leading courageously, leading passionately, leading successfully into the C-suite, the line of business, and the boardroom. Take a glimpse at this video here today. It's an enlightening conversation regarding the growing disruption of telehealth spurred between Tim Crawford and Charles Unger during a recent Silicon Valley Global Innovation Advisory Board meeting. You'll want to be there. You'll want to be at the advisory board meetings digitally and in person. So stay with HMG Strategy and stay with Hunter.
14,000 people a year die from SARS version 1. And if you don't want to be traveling to India in the flu season, because the variants of SARS and other flus kills about 48,000 a year in India, not regular flu, but other variants. So creating vaccine technology driven by digitalization, the healthcare orgs have moved, right? The healthcare orgs are now, who is my innovation guy or girl? Who is the digital person? Who is the CIO? And their big push that they've been talking about for a year is who owns technology, who owns innovation, and who owns information. And you know, that is phenomenal that you have a whole industry that is predicated on doing the best they can for the person, but Oxford and J&J and how some people have actually shared the information is phenomenal. Just you know, you see a technology leap and bound change, but I see the opposite effect as well, which is quite fundamentally annoying, being in meetings in Washington, D.C. over the last couple of weeks and months. They don't want to have telemed anymore.
I've had 2 doctor's appointments in the pandemic, both of them remote, and they were phenomenal. Like, better use of my time in general. That's perplexing.
They are literally saying that maybe it should be bound to 50% of appointments should be telemed. And having telemed appointments is not beneficial for the delivery of medicine.
Too disruptive to the whole ecosystem and too disruptive to the insurance paying process that it becomes so efficient that it disintermediates the industry.
The guys at Aetna were in the room and said, we actively want Aetna as a payer wants the organizations to do things more digitally. And when I ran the program at Stanford around, we had a digital clicks and bricks model it was called the ClickWell Clinic. We actually launched it as the ClickWell Clinic. As of today, they have 1.5 million active users of ClickWell Clinic on a weekly basis. We launched it at 250,000 users in 3 weeks. We went from 1 doctor, 5 nurses to 40 doctors on shift, 15 continuously live, and a staff of 70 nurses. 2.5 years after I left, they said they wanted to change it to a bricks model and have tele only, where you can actually do tele as a component. But what we've done as a bricks and clicks model was we changed the dial to 0 copays. I don't know if you saw yesterday, Aetna announced that if you do tele visits going forward, no copay. United C-suite had a huge managerial change this last year. I don't know if you guys watched it, but they are transforming to being a digital company. Their CEO explicitly told National Academy of Medicine, we are not a medical company. We're a data and digital company.
Wow.
They have to.
Wow.
They have to survive, because there is a potential path here where the payer gets excluded from the value chain.
True.
And so if they don't make those changes, which, having worked with some of these payers, I will say that it's not a trivial change, but they have to make that change.
Absolutely. It's pretty cool. It's generational change, is, you know, that's how long it's going to take to do some of this. But the first thing being, as Hunter, you talk about, right? They believe in digital. What it, could be transformational. It's kind of like you sit there and go, the big one out there right now that's very quiet, subliminal, and do everything is, Amazon. They now call it Amazon Pharmacy instead of RX, right? The growth in that globally, they're targeting. India's massive for them in the digital pharmacy space. They're growing at three-digit % ratios every single month. It's phenomenal. They're trialing a lot of things outside the US just because of regulatory issues, but they are licensed as a pharmacy in every state bar 2 now. Very quiet, very under the radar, but PillPack that they bought, and now they're calling it Amazon Pharmacy. That service is phenomenal, right? Absolutely phenomenal, and disenfranchises the whole pharmacy edge space. They're actually advanced pharmacy license, I think. Can't remember that in 1 or 2 states now, so they can actually do interesting medications. That CVS is the top advanced pharmacy in the United States now, with the amount of locations that they can give out. Things like, drugs for multiple myeloma and other things. So interesting space, very, very different, very changing, phenomenal.
Tim, you want to jump in?
There's this huge discrepancy between what we have today is the what I call the traditional CIO versus that transformational CIO that has the vision. And I think one of the characteristics that is sorely needed in order to fulfill what Charles was just outlining is creativity. I mean, we're missing several attributes, and I really need to write this up as a blog post, but things like just understanding fundamentals about your business. I'm shocked, absolutely shocked at the number of IT leaders that still don't understand financials about their company. They understand the block and tackling numbers, but they really don't understand the depth. They couldn't tell you from a CEO's perspective how their company is run, how their company is able to manipulate how they move. And so that plus creativity, plus a number of other attributes is just really missing. And we have to think about how to infuse that into the profession, because if we don't, the gap that we have today is only going to get bigger. And that's going to be really problematic ultimately for our customers.
I think the CIOs had a political job for such a long time in a lot of organizations that the C-suite see them as the technology person, right? And you had to sell a lot of why you needed to do something, and people couldn't understand why you needed that budget or that team or whatever. I've always sat there and said, if you want to move the bottom line, the cost of your product, there's a 12-cent line item in there that's technology, right? You have to put it a different way, right? You can't walk in and say, hey, I need a load of security tech, right? But they've scared the C-suite into that position. They're also then perfectly, Tim, and I texted everybody, they're in scared and protectionism mode. So many CIOs that I meet, CTOs as well. I met a CTO 2 weeks ago that's in healthcare, big healthcare org, $25 billion. He's from finance. I just bought $30 million worth of security tech and had to justify it. You're like, you're in healthcare, and biggest issue right now is security as well as pandemic. And you went in there to justify $30 million worth of security tech when you're a $25 billion healthcare system.
Charles, let me jump in here and really thank everyone for being so open. Charles, Tim, everyone, Mike.